Well, South Africa is tense amid a resurgence in COVID-19 cases in some parts of the country. There is uncertainty now about the second phase of the vaccine rollout that is meant to begin next week, and reports that people are jumping the vaccination queue. The abuse of the system has been highlighted by videos of people who are not healthcare workers lining up to be vaccinated. To discuss the situation, we're now joined by the editor-in-chief of Bhekisisa, Milan. Ms. Milan, thank you for being with us. Let's start with the latest reports of doctors' wives, people who aren't linked to healthcare in any shape or form, being vaccinated or sort of jumping those queues. What is the situation as far as you know?
So what has happened is that the Sisonke trial was paused for 2 weeks, as you may know, because of investigations around the Johnson & Johnson vaccine. And during that time, the trial lost days to vaccinate people. And any trial has a beginning and an end date. And according to a press conference this morning, the end date of the Sisonke trial is Saturday, the 15th of May. So on the 6th of May, a little bit after the trial restarted, after it was paused, there were a lot of vaccinations left. 500,000 J&J vaccinations was donated, and on the 6th of May, about 130,000 of those doses were still left. And because it meant that the trial would have to move much faster to finish those doses by Saturday, the health researchers broadened the definition of who qualifies as a health worker to come and get vaccinated. So it essentially meant you didn't need to be a frontline worker, you could be support staff, you could, it was a little bit broader, far more people. Essentially, you could work for a medical aid scheme, and you could then also now come for a vaccination. And some people have started to abuse that system. So some of the reports that I've heard of is that how do people cheat? Well, they get family members, say if your sister or brother is a psychologist, you get them to write a letter for you that you're a health worker or support staff, a receptionist for them, and you then take that letter to the site, register on site, and get vaccinated. There's been reports at some sites that people turned up without letters and were still vaccinated. And there's also been reports, for instance, at Charlotte in Johannesburg, that people of 60 and plus went there and got vaccinated without letters. I've certainly seen today that on social media, where there were very many reports yesterday of people who managed to do that people were stopped at definitely some sites doing that today. There were lots of reports at Mitchell's Plain, for instance, in Cape Town, that many people could just turn up and get vaccinations. Today, I know of people who have called me who have tried to do that, and they weren't able to do it if they couldn't prove that they were a healthcare worker.
This abuse, to you, does it sound like it's isolated cases or rife?
According to the Western Cape's Health Department, they had a press conference this morning. It is not rife, it is isolated cases in that province, and they're going to try to stop it. From people that I've spoken to, for instance, I spoke to someone who went to Mill Park in Johannesburg, a health worker, and she said that, from the conversations that she heard around her, she would estimate that a quarter of those people who were just standing around her were not health workers. Sure. When I was at Charlotte earlier this week, there were certainly many people over 60 who didn't look like health workers. They were in wheelchairs. They were very, very old. They definitely didn't look like they were working. And some doctors confirmed that, people did turn up and some of them did get vaccinated. So it's very hard to say what is the percentage, but definitely the Western Cape Health Department's perception is that it's not rife.
And explain that. I understand the trial was coming to an end, but why expand when all the doctors and nurses haven't been vaccinated yet? Why couldn't we sort of speed up the jabs to the frontline workers first? Is that a valid question?
I think they did speed up the frontline workers first, and then after the trial was paused, they struggled to get enough health workers to register fast enough. And all trials have rules. It's called protocols. So it's like sort of who can participate in the trial, when does it start and when does it end. And in the case of this trial, it ends on Saturday, the 15th of May, according to the Western Cape Health Department. And part of the rules is that the vaccines that they used in this trial was specifically donated for the trial. It's research doses. And if it's not used by the end of the trial, it has to be returned. We can't take it and use it for the national rollout that starts next week of phase 2, for instance. So what they're trying to do is to get as many health workers as they can. They're trying to use up the doses, essentially, because they certainly wouldn't want to return it to J&J. And I do think that they're putting in a significant effort to get enough health workers at the moment. Yeah. It is just that it opens the system up for abuse if they're getting so many people coming for vaccinations each day. At the moment, if we look at yesterday and the day before, 15,000 and 18,000 people per day. Prior to that, it was closer to 10,000. So I think those sites are really dealing with a lot of logistical challenges.
Yeah, and let's just remind viewers that earlier in the year we were talking about reaching herd immunity by the end of the year, and then South Africa had to ramp up to 200,000 jabs a day, and we're just nowhere near there. Ms. Milan, can you look back at the Sisonke trial as it's wrapping up? What has been achieved there? And then what are the predictions for Monday when this should all expand? A lot of uncertainty, 60-year-olds and plus, but many are saying that they're not getting confirmation. Nobody knows if they will get the jabs or not. What's the situation?
Well, with regards to what has the Sisonke trial achieved, I think the main goal of this trial, besides the clinical data that they want to gather, but the main goal was really to give health workers access to jabs in the country before any vaccine was registered in time for that. So while we were waiting for the registration for the J&J jab to come through, we were able to use it in a clinical trial. And I think that is a big achievement, because without the trial, we wouldn't have had access in February to jabs for health workers. Now, it's important to know that this is not the end for health workers. On Monday, we're starting with 2 phases. Phase 1B, which is health workers that are not covered by Sisonke, and we start part of that for people who are 60 and older. So there's a lot of information that we don't have yet. I think the health department has really been very slow with communication. They could have done better with this. But here's what we do know. We do know that we have 1 batch of Pfizer jabs that we can start with on Monday, and that those vaccinations have already been distributed to provinces. That happened yesterday and today. And the Western Cape Health Department this morning announced that they've already received their part of that batch, 30,000 jabs. For Pfizer, you need 2 shots. So that means if you have 30,000 jabs, it's really, it's covering 15,000 people, and that they will receive a consignment each week. And in the Western Cape, that's the department that we really have the most information of, because they've had regular updates. They said this morning that they will start with old age homes. So people of 60 and plus would not receive their text messages or SMSs now. They will only receive that in about 2 to 3 weeks from now, once the old age homes have been covered, and they're going to go to the old age homes with teams, outreach teams, and they've registered them in bulk on the EBDS system. Yeah. And we also know that there are other ways now to register on this system. It's no longer just the website or go to the site. There's also a WhatsApp service and a USSD service, which is a text message service that you don't have to pay for.
Okay, I think that's good, because it explains to many people why they're not receiving those confirmation messages if they're above 60. Then how, finally, is the registration online, or you're saying that there are different channels? How's it all going? I guess it's fine if you have data, but some questions around elderly people in rural areas, say.
So the only data I have at the moment is the Western Cape Health Department this morning said that 27% of people of 60 and older have registered on the system. And that's obviously not even a third of the people. So there needs to be a big campaign at the moment. They're going to old age homes and physically registering the people for them so that they get more people on the system. We have not had a national figure of that. And so we don't know what the percentage is nationally of who have registered so far.
All right. Maybe the message is register if you are eligible, at least be in the queue. Thank you for that very informative update. That was the Editor-in-Chief of Bhekisisa, Milan.